Hello and welcome to Fact Files from the Front Lines on BOOM. There are about 500,000 nurses under the United Nurses Association, which is headquartered in Kerala, of which about 22,000 are in the state of Maharashtra. Now, the city of Mumbai has anywhere between 6,000 to 8,000 nurses who are registered to this association alone. This is a little significant now because we have had a couple of outbreaks in hospitals, including the Wockhardt Hospital, and where about more than 26 nurses and 3 doctors were tested as COVID positive, quite likely because the infection spread from a non-COVID patient who was also in the hospital for another treatment. The larger issue this raises is the kind of conditions that the nurses are working in, the personal protective equipment that they have and they use or are using effectively, and what are the challenges ahead in that regard, even as we continue this fight against COVID-19. So to discuss this, I'm joined by Jibin T.C. He is the president of the United Nurses Association for Maharashtra and based out of Pune. Jibin, thank you very much for speaking with us.
Thank you.
So what exactly from in Mumbai?
All right. So there are two things in that. First of all, there was no proper management. That's one thing. When you look at the nurses who was infected, they were in direct contact with the patient who was admitted there and tested positive. And during that time, the nurses were not getting adequate protective equipments. That was the one thing we observed. Because of that, they got infected, and simultaneously the infection went to multiple numbers. And second thing is awareness. So when you handle with any new pandemic like COVID-19, you should be informed well. Nurses were not given proper training or information related to COVID management. So that second thing, what we observed, the rate of infection has increased.
Okay. Now, what is the number that you have for nurses who are infected? Now, it's not only Wockhardt. We also saw nurses and doctors in Jaslok Hospital, for instance. I mean, these are the ones we know of. Now, were there any of your members?
Yeah, some of them are members from Jaslok and even from the other hospital, which is Wockhardt. And we have come to know there are around 50 plus nurses tested positive recently from these two hospitals. From Wockhardt, we have come to know around 40 plus, and Jaslok is around 7, and 7 plus nurses tested positive.
Right. So you're saying almost 50 nurses have tested positive in the city of Mumbai. Do you have a number for either Maharashtra or for India from your association?
Maharashtra, we have, I think now 53 is the number. Okay. And from Delhi, we have come to know around 23 nurses tested positive from Delhi. Okay. These are from Kerala, there was one female nurse tested positive, and she got discharged also. She recovered from COVID, and she is in home quarantine now. But apart from these three, we do not have any information pertaining to COVID-19 updates.
Right. So you're saying about a little over 50 nurses between Delhi and Mumbai, which of course as cities and centers have the largest number of cases. Almost now Mumbai has more than 600 and Delhi is close. Now, these nurses, are they all, or rather, what is the current treatment and what stage of recovery are they?
So we do not have much of information because we do not have access to these centers. Okay, we being an outsider, we cannot enter to this hospital first of all, and you cannot enter it because as we need to maintain the social distancing. It's not good to go inside the hospital and check for all physically. So we have communicated with them through a telephone. So they're all doing pretty well, and none of them are not in that scenario where their life is in threat, and they're proper treatment from the facility. That's what we come to know.
Right. And is that also, I mean, could one reason be that they are also much younger and therefore not so affected?
Exactly. So I'll give you an example. So a nurse from one of the hospitals, one of the Mumbai hospital, she is at around 43 years age. She were having some difficulty. That's the reason they have shifted her to another facility where she needs to have more advanced treatment. So it's also depends on the age factor. That's a very true. I mean, nurses majority of them are being young, so they are not that much affected with this COVID.
Right, and a slightly different question. Would nurses, I mean, and I'm sure a lot of lay people would ask this, I mean, would they have a higher level of immunity compared to others? Because, I mean, because in a way, this shows that they don't.
Yeah. Actually, the thing is that they're being exposed to these kind of infection every time. Okay, so when a nurse work in a department, especially like a critical care area, you will have multiple infectious diseases comes around you. So they tend to develop their own immunity sometimes. Okay, maybe because of that they are not getting very frequently infected. But of course, there are other factors also depending on their work schedule. If a nurse work beyond 12 hours continuously for a week time, definitely her immunity will go down, right? So
Right.
in that scenario, yes, there are a high chance of getting infections.
But are you getting a sense, Jibin, that in the case of COVID-19, the chances of infection are higher? I mean, because in normal cases or normal course of things, we don't ask, are nurses getting infected? Because I mean, even if they are, we assume they're recovering. But are you getting a sense that COVID is more dangerous in that sense? It's also affecting people who are involved in the treatment or the medical process?
Yes, of course. When it comes to nurses, frontline workers, I mean, they're the frontline professionals who are in continuous touch with the patient. Very oftenly visit the patient. So the contact with the patients are increasing when. So that's one thing. They are getting high chance of infections through COVID. So we feel yes, it is dangerous to because they almost spend good time with the patient, a long period.
Right.
For an example, if a nurse worked at least an 8-hour duty, she would be there with the patient almost 7 hours. So just 1 hour she'll be doing her other work. Right?
Right. Okay. So that's an important point. I mean, nurses, of course, as we know, are exposed, but if their conditions are tough and as they are all over the world, and we are seeing that, this obviously makes them more susceptible and less immune. So, Jibin, in terms of personal protective equipment, so what is your association doing to ensure that your members are given personal protective equipment, how are hospitals responding both in the government as well as in the private sector?
All right. So first thing what we are doing, we are making awareness to all nurses. Okay, we are pass on the information to every individual who are in touch with us, and we are trying to make them understand what is important using a PPE. Because without PPE, if anybody works in the department, they are in a high chance of getting. And second thing, what we are trying to communicate with the management, it is better to give a protective equipment rather than treating a patient, right? So once our nurses get infected or any health professional get infected, later stage we would not have enough or adequate staff to take care of the patient comes in, because as you understand how the COVID numbers are increasing by day by day, we need more health professional into the system. And if they get ill and they get admitted in the hospital, then who will take care of this upcoming patients? That's our concern. So as a responsible association, what we are trying to do, we are in touch with government officials who handles this PP and who handles this COVID-19 outbreak, and also in some of the professionals who can help us in terms of getting information related to this. And the same information we are passing to the nurses, and we are trying to get more information and spreading awareness among the nurses.
But awareness is an important point. But apart from awareness, the physical equipment, including obviously masks, I'm sure is not so much of a concern for them. But beyond that, is that available easily, or does more need to be done?
Oh yes, there is a huge shortage globally, because most of this product comes from some of the countries from Europe and especially from China. So we were getting most of this product from China and US. And nowadays we are not getting it from those sources, because as you understand, there is a huge shortage globally. And as an India, we do not have much of a manufacturing facility in India to make these kind of products. I think government should more focus on manufacturing these products locally with a good quality. And that should be the one priority, because as we understand, we have a huge population in India. To cover up this huge population, we need to have a good manufacturing facility and good quality products, so that we can tackle this scenario very easily.
Right. So amongst the nurses that are now exposed to COVID, because I mean, obviously all of them are not, how many do you think or do you feel have access to personal protective equipment, and how many may not in the way it should be there?
See, as per our understanding, none of them were given any protective equipments in the initial time. So the moment the two nurses turned positive, since then they started giving masks to the nurses in the ICU. Initially, they were informing everybody not to wear a mask in the ICU setup. So that was against the protocol. So every nurse who work in a critical care area should be given with adequate protective equipments. It's not that they should be given entire COVID kit or the PPE kit. Okay, when you have a COVID patient, yes, of course, you need to provide with adequate PPE kit. Otherwise, you need to give them with an N95 mask and nitrile gloves. That's more than enough.
Right, but are you saying, Jibin, that even within the ICU, which I thought was standard, people were moving around, nurses were moving around without masks? I thought to enter an ICU, you need a mask, don't you?
Exactly. You need to wear a mask when you enter into the ICU setup. That's very mandatory.
Okay, but you're saying that in some of these cases, according to you, they were not getting or were not given masks?
Not given masks.
Okay. Anyway, we need to verify that with them as well. Anyway, we're running out of time, Jibin. Your message to those who are interacting with your association members, the brave nurses who are fighting this battle, and what are you looking for in terms of help for them?
All right. So first thing what we have to tell you is that you are fighting against something very, very serious. We are globally fighting. So as a nursing professional, it's our responsibility to take care of our nation and our people health. So at any point of time, our people would be there to help anyone who is in need. Also, I'll make sure that all the nurses should be given adequate PPE. Without PPE, I request everybody not to work, because you are not only putting your life into a stake, you are putting somebody else's life also into a stake. And also you are spreading infection to other people. So my sincere request to every nurse and a professional, if you don't get any PPE, make sure that you will get it, then you start work. That's a simple request from our end.
Right. Jibin, thank you very much. And I wish you and your colleagues and members all the best in this fight ahead against COVID-19. Thank you so much.
Thank you for your support. Thank you.
Thank you.